Hi there. Welcome to the MARCH program. I'm Mary Jo Bondi. I am an associate professor at the graduate school and a physician assistant.
Hi, and I'm Jessica Lee. I'm an associate professor in the Department of Medicine in the Department of OBGYN, and I'm also an abortion provider. Thank you so much for your interest in the MARCH program. We are grateful for your support of reproductive health. Across the U.S., access to contraception and abortion services and education is being restricted.
In Maryland, where we have progressive policy to protect reproductive rights, 63% of Maryland counties lack an abortion clinic, according to research published in 2022 by the Guttmacher Institute. That translates into 15 counties of the 24 counties within Maryland.
As clinicians and researchers, we know that abortion is a safe and legal way to end pregnancy and is part of essential health care. We know that abortion is common. In fact, 3 out of 10 pregnant people in the U.S. have an abortion by the time they're 45 years old. Maryland previously was a physician-only abortion provider state. However, as of 2022, Maryland law allows for advanced practice clinicians to provide abortions as well. Abortion is covered by state Medicaid here. Maryland is considered an abortion protective state, and we are so fortunate. And our state continues to pass legislation to protect this essential procedure and the providers who deliver this essential care. Patients from other states travel to get their abortion care with us.
As part of the Abortion Care Access Act, passed in 2022, the University of Maryland, Baltimore has been awarded a $10.6 million grant to administer Maryland abortion care clinical training. Our goal is to expand the number and diversity of healthcare professionals with abortion and advanced contraceptive care education and training. Through this grant and our efforts, we aim to expand contraceptive and abortion care access for people throughout Maryland. We aim to specifically increase training clinicians in underserved areas and rural areas in Maryland to help reverse health inequities and to provide reproductive health care services to those with the greatest need.
So who would be a good candidate for our program? We aim to recruit currently licensed clinicians, including nurse practitioners, physician associates, and certified nurse midwives, and physicians interested in gaining competence in contraception, medication abortion, and exposure to first trimester surgical abortion. We also are seeking future clinicians in training for the following degree programs: nurse practitioner, PA, DMSC, CNM, MD, or DO. We welcome clinicians across all specialties as we believe abortion care is a crucial component to training for any specialty. If you have a desire for achieving clinical competence in first trimester abortion or second trimester abortion, we are working on clinical training opportunities for that as well.
Those who enroll in our program will participate in an online abortion training curriculum, the TEACH curriculum written by our partners at UCSF. You will also receive instruction in Maryland-specific content. The online learning can be done at your pace, on your schedule, within the first portion of the program. You will also receive instruction in ultrasound through our partnership with the National Abortion Federation after you complete the didactic learning. The training program will conclude with a 2-day in-person clinical simulation training, either at UMB or in your local community. We'll bring training to you. This will be done to assess competency in advanced family planning topics, including delivery of medical abortion, as well as basic ultrasound interpretation skills. And you'll gain hands-on exposure training to first trimester procedural abortion.
The TEACH curriculum provides approximately 30 CMEs. Dependent on your familiarity with the content already, it can take approximately 15 to 30 hours of self-directed, self-paced learning, and then we'll have the 2 days of in-person simulation training. We're working to meet our learners where they are using 2 abortion training mobiles, where our faculty will come to you.
We will also provide stipends for those who complete the training. We'll be providing longitudinal support after our learners complete our training program. Our social worker and grant team will be checking in with our graduates. We'll be regularly communicating with participants to learn about their successes and obstacles when providing contraceptive and abortion care following training. We hope to gather our graduates in a future event to establish a support network, a space to reflect on the program's impact on abortion in Maryland.
Our March team is passionate about expanding abortion care across the state, particularly to advanced practice clinicians. We know that well-trained clinicians positively impact patient experience. Abortion care is health care and would not be possible without you. Thank you for your interest and commitment to the fundamental right to abortion that every patient deserves to have access to.